So let's shift the focus from having a checklist before joining a college or specialty to questioning oneself. What can I best
Remember that success is not just about reaching your destination, but it is also about enjoying the journey and learning everything that comes along with it. Hi, I'm Dr. Ruchita Joshi, and today we bring to you another episode of Tooth Talks, Navigating Your Dental Journey. And today we have a very unique branch, which is a blend of technical expertise, art and science, and patient-centric approach. Yes, you've guessed it right. It is the Department of Prosthodontics. Together with Cuspyd, we have explored so many different paths and branches that you can pursue so that you can finally take on one which resonates the most with you. I would definitely like to thank Cuspyd for that. Cuspyd is an evolving edutech company which is putting out some great content for all the dentists like you and me with a unique blend of technology and education. So we are here today with Dr. Mansha Saxena. So she has done her graduation from Army College of Dental Sciences, Secunderabad, and Masters in Prosthodontics from Govt Dental College and Hospital, Hyderabad. Welcome to the show, ma'am.
Hi, Chita. Thank you for having me here.
So, ma'am has a lot of credentials to her name. She is an APPG rank 10 holder and Telangana state rank 3 holder. Ma'am has also done her fellowship in cosmetic and aesthetic dentistry. So over the past few years, ma'am has been working as a consultant prosthodontist while also continuing teaching and tutoring all the budding dentists and specialists in various academies. She has also recently presented her research paper at Youth Conclave 2022 at IIT on sustainability in dentistry. So without any further ado, let's get this conversation started, ma'am. So, ma'am, can you tell us about the scope in prosthodontics? This is the most sought after question.
Yeah. So prosthodontics as a specialty deals with diverse patient population, and hence it has a broad spectrum of the treatment procedures that we follow, including right from the implants, dentures, crowns and bridges, veneers, laminates, smile designing, full mouth rehab, TMD, occlusion, geriatric dentistry, maxillofacial prosthetics, and dental materials. So as a prosthodontist, you delve deep into the dental materials, right from the cements, composites, impression materials, instruments, waxes, etc. No other specialty explores with such high detail. So the scope of prosthodontics is vast.
Definitely, ma'am. And I agree about the part of dental materials because that is super important in this branch.
Absolutely.
So, ma'am, coming to the job opportunities, what all is present out there if someone has done MDS in prosthodontics?
Job opportunities for this specialty is again immense, diverse. Starting from your government sector roles, where you might join as a dental officer in armed forces, government organizations, colleges, institutes, hospitals, ESIC, ECHS, etc. Or set up your own private practice or work in corporate clinics. Then you have opportunities at prestigious institutions such as GDC, AIMS, Maulana Azad, VMMC, Lady Harding, and many other organizations or the hospitals, government hospitals, where you could join as senior resident.
Okay.
Yeah, so the contract of your senior residency program might vary from south to the central states, that is in Delhi, which spans for about 3 years in Delhi and 1 year in south. Then you have teaching roles in private colleges, institutes, academies. Then a prosthodontist could also clinically train a young dentist or specialist in their practice, train them, tutor them with their skills, then pursue your PhD and develop your academic interest. So other avenue being a dental lab specialist. So you can join you and work as an in-house prosthodontist.
Okay.
Yeah, the lab specialist in various dental labs. Then there are several opportunities with various dental companies such as Dentsply, Sirona, Trios, where there are opportunities for the specialist as well.
Okay. That's really great, ma'am. People say that there's no scope in dentistry or something like that. And for one specific branch itself, you've told us so many job opportunities.
Yes, and I'm sure there are many, quite many. Yeah, apart from the ones that I mentioned, I'm sure there must be many.
So, ma'am, coming to my next question. If any UG student feels that his or her prosthodontics handwork is not up to the mark or they're not good at it, so can they still take up this branch? And do you have any tips how to tackle this prostrophobia thing?
Absolutely, it's a wonderful specialty, and one must think of taking this department as a preference. Having limited proficiency in one's prosto handwork should not be the sole criteria or the determining factor whether to pursue this field or not. And there are certain aspects which could be addressed to deal with the prostrophobia. So identifying the root cause is very important. The student must take time to understand from where this phobia is starting or arising. For some students, it might be due to the fear of failure, whereas others might feel anxious of dealing with the patients and the more intricate lab work. Many students might not be exposed much during their undergraduation. That could also cause the fear into the student. So all these needs to be addressed first. The student can have an incremental approach where they start off with smaller procedures first, simpler ones, and then progressively advancing towards more complex ones. So that is how the fear keeps reducing over a period of time. And celebrate your successes, no matter how small it is. It's always best to celebrate your successes.
Yes, ma'am. Treat yourself after your first
Absolutely,
denture.
yes. And then pair up with proper mentors, guides, faculty who help you, mentor you, and guide you through your journey
Yes,
with
ma'am.
your clinical work, lab work, and have a strong theoretical foundation before you embark on your practical journey.
Yes, ma'am.
That's very important. And lastly, have a growth-oriented mindset. So yeah, that is how you deal with it.
Okay, ma'am, that was very interesting. So I think you've given a lot of tips to our viewers how to handle prostrophobia. I'm sure it will help them a lot in their journey. So coming to someone who has now tackled their prostrophobia and they have decided to go ahead with prosthodontics as their department of choice. So what can they expect will be taught to them in the curriculum in the 3 years of MDS?
Okay, so the curriculum, you can find it, any student can find it on the DCI website. There is a proper MDS regulation that has been released. You can download it from there, go through it. But to give a gist of it, the first 6 months are going to be your preclinical training, where you're not exposed to the patients as such, but then you operate on the cast, models, etc. You're trained in your theoretical knowledge first. And then the rest of the curriculum deals with, I have already covered the sub-disciplines of prosto, which deals, for example, being your crown bridges, dentures, implants, smile designing, etc. All of these needs to be covered in the rest of the curriculum.
Okay.
So you're expected to finish that as well.
Okay, so basically students have to follow the DCI curriculum. They've set everything for. So dentistry doesn't have to be totally serious or boring. It can be really fun and interesting too. So have you checked out Cuspyd's Instagram page, because they are putting out some great fun dentistry related content out there. If not, do check it out. So coming back to my next question, what all things should one keep in mind while choosing a college specific department of prosthodontics in that college? What all they should keep in mind for that?
So let's shift the focus from having a checklist before joining a college or specialty to questioning oneself. What can I best offer to this program and specialty? And what is the best I can do to utilize the existing resources that are being offered along with my aspirations and goals? So for example, let us say if you're provided with all the resources, equipments, faculty, everything that you require, you have everything. But if you do not have the proper inclination, you do not have that goal, you do not have that aspiration to learn, and you do not have the knowledge how to utilize it, then whatever is being provided is of no use. It's important that you question yourself first. What exactly I can offer to this program and specialty? So when choosing a college for prosthodontics, assess how you can contribute to the academic activities, actively participate in research discussions, your clinical experiences, and assess your faculty's expertise and the research opportunities that they provide you. Just find out how the prosthodontic lab is equipped with, the equipments, the facilities that are being provided at the lab. So this makes a huge difference
Yes, ma'am.
to the students' curriculum or the program.
And lab is as equally important as the clinical thing in prosthodontics. Totally agree with that. And since you are a prosthodontist, so I wanted to ask you that are these 3 years of MDS worth it in the end? Because we all hear that prosthodontics is too tough and you have to manage so many things, lab work, clinical work, and academic work. So do you think that is it worth it in the end?
No doubt it is a rigorous and comprehensive program that not only expands one's understanding of the subject, but also exposes you to the back-end work or the lab work. So you'll have to deal with long working hours, both clinical and the lab. So you develop proficiency in the laboratory skill set. So the uniqueness of this specialty is that it not only encompasses the clinical work, develops your skills in the laboratory procedures as well. So one can learn to balance their clinical work, lab work, and the personal time by learning how to manage and prioritize your task and time strategies.
Yes, ma'am. I agree that time management plays a very crucial role here. Coming to a student who is not able to cover up everything in the 3 years of MDS, being that they're not able to manage their time because so many things going on. So after graduating, can they still take up fellowship courses or some diploma courses to learn things like full mouth rehabilitation, smile designing, and all the advanced procedures?
Yeah, given the time frame, the limited time frame of 3 years, it is always not possible to include all the subdisciplines or excel or master or learn in depth about all the subdisciplines that I mentioned for this department. So yes, a candidate can pursue fellowship or diploma courses. However, it is imperative that they enroll into a nationally and internationally accredited course institute, because it helps the candidate in advancing their knowledge authentically and recognition.
So, ma'am, you told us about a few fellowship courses and diploma courses. So, is it mandatory to do after post-graduation, or as an undergrad also you can pursue all these?
No, I would suggest the diploma courses or the fellowship courses that are being offered must be pursued by a postgraduate and not an undergraduate, because you are not theoretically sound enough to take up the clinical training that is being offered.
Yes, ma'am, I totally agree that post-graduation adds an edge to your approach and your skills towards dentistry. So, ma'am, coming to another question which is related to all the budding prosthodontists. So, what advice would you give to someone who has just joined in first year of MDS in the Department of Prosthodontics?
Firstly, networking is crucial.
Okay.
Interact with your colleagues, your peers, faculty of other colleges, attend conferences, seminars, workshops, talk to them, gather as much data as possible, prioritize the task, create a schedule, and have your workflow streamlined, because in this specialty you'll have to deal with both the clinical and the lab work. So streamline your workflow process in a way that you can manage the time well for both.
Okay.
Yes, and adopt certain measures or protocols where you can manage both in a well-mannered time frame. And embrace technology, use digital tools and software. Also set realistic expectations. Understand that achieving a proper or perfect balance is not always feasible or possible. However, try to be flexible and adapt to the changes that might happen. And yes, go through your journey well. Take breaks and engage in self-care activities like exercising, meditating, or take up any of your hobbies to avoid the burnout through your journey. And be open-minded, be open to learning and improving.
So I am sure our viewers have taken a note of all the tips that you gave, and especially for someone who will be joining in MDS first year in this upcoming counseling, I think they'll be benefited by all this a lot. So ma'am, keeping aside all these technical questions which we've lined up for you, I also have some fun questions because we want to know more about you as a person and your preferences. So this one is called This or That. So you have to choose one among the two options that I'm giving you, and it
Okay.
can be like a rapid fire thing.
Oh, good.
So ma'am, FPD or implants?
Implants any day. It totally depends on the case scenario. As in, if the condition is conducive and the patient criteria falls into place, then yes, implants. However, if the case is not ideal for an implant, then yeah,
Okay.
fixed dentures, yes.
What about lab work or record maintenance?
Record maintenance as in documenting, register
Documentation
work
and
or
everything in
something
your
like that?
PG. Yes.
Okay, then it would be lab work any day. I love lab work.
Okay.
And whenever time permits, I travel to the lab. I do my own lab work. I still do my own lab work.
Okay.
Yes, I'd love to do it.
That's amazing, ma'am. So coming to the next one, that is either cosmetic procedures or rehabilitative procedures.
Difficult to choose.
You can choose both if you
Yeah,
want.
then both. Yes, both the procedures are rewarding. It's a rewarding experience to deal with a cosmetic case and a full mouth rehab case. So yes, I'll choose both.
Okay, ma'am. Ma'am, can you tell us about any hack in prosthodontics that has made your life easier?
Oh yeah, I have a lot of tips and tricks up my sleeve. But then for now, we'll stick to a few. One is about the case documentation. Invest in a very good DSLR camera,
Okay.
lens, and a flash is going to help you in this journey very, very well. Second is digitizing your workflow. That is your cases, appointments. It'll save a lot of time and effort.
Okay.
And it'll help you in not losing very important data. Thirdly, it is please read the instructions manual of the materials that you're going to use on a patient. Very, very crucial. I see many dentists and students not being aware of the properties, the basic proper handling of the material or the equipment or the instrument, and then approaching a patient.
Okay.
That is something I don't believe in. So very important that you please kindly never approach a patient without being well versed with the properties of the material, equipment, instruments, and also knowing about their specific limitations. Also imperative that you have a clutter-free environment in your clinical and your lab area. Having systematic arrangement of the instruments, materials in your clinical area, it will save a lot of time and effort.
Yes, ma'am. Prosto can get really messy. Like there's so many materials, and especially with the plaster work. So I think it's very important to keep things neat and clean over there. Ma'am, can you tell us something that PG life taught you that you didn't learn in UG?
Oh yes, quite a many. One of my seniors said that post-graduation not just teaches you about that specialty of that or that field, it changes you as a person. So the person who enters the PG curriculum is not the same person who walks out of it. So it changes the approach, how you look at life, how you deal with people, how you deal with relationships, how you manage stuff, how you manage yourself. So it teaches you a lot.
So ma'am, can you tell us a little bit more about your college experience?
The college experience was great. I would like to share a small bit of the journey on how it started. So it's a funny story. Those days we had APPG. Ours was the last batch to appear for APPG. Soon after that, there was NEET. NEET started the next year. So there were 3 rounds of counseling. Despite having a rank of 10 in APPG, I had to appear for 3 rounds of counseling. So after the first round of counseling, since the prosto seat wasn't open for the general category, I had to wait for the second round. But then I had to choose some department. So I chose ortho. I started going to the department. I started doing the wire bending exercises, the preclinical program, everything. And I appeared for the second counseling after 10 to 14 days. And then during the second round of counseling, I see that the seat is still not open. Due to some technical issue, I believe. There was some issue. So I couldn't select the department again. I went back to the department. I continued my preclinical exercises there in ortho department. And then came third round of counseling. So just before third round of counseling, the HOD of that department, ortho department, asked me a simple question. are you sure you still want to join Prostho department? Because you've already started your journey here. You have started with the preclinical exercises, wire bending and all. Are you sure? Do you still want to join the department? I was, yes, sir. I'm really passionate about this branch, and yes, I will definitely join this branch. I definitely would like to go for third round of counseling. And then, yes, the third round of counseling happened, and then
now you're here.
Yeah, now, yes.
Great, ma'am.
So that is how much I love Prostho.
Yes, ma'am. After this interaction, I can sense that your passion and love for prosthodontics, and I'm sure it's contagious. It must have inspired so many students out there.
And remember, college is not just about what you receive. It's about what you can contribute.
Okay. That is also a really nice approach to go about it. Ma'am, we're really grateful that you came here and you shared your knowledge and expertise with us. You took out time from your busy schedule for sharing all this. So thank you a lot for coming on this episode. And I have a little token of appreciation for you. Ma'am, this is for you.
Thank you, Ichita. Thank you for having me here. And thank you, Team Cuspyd, for arranging this very interactive talk. Thank you so much.
We hope you found this video to be super helpful and inspiring. And remember that learning never stops. So go out there, keep expanding your dental knowledge, and that is the beauty of this field, right? And don't forget to hit subscribe and share this video with your dental squad. And if you've not checked out the previous videos yet, you definitely should. Do check out Cuspyd's Instagram page, where they're putting out a lot of fun and interactive content like comics and book recommendations. And stay tuned for more epic content. Have a great day.